Welcome everybody. Yeah, welcome everybody, and thank you for being here. I did want to say before I start that this session is being recorded, and this is so that we can provide it to anybody who wasn't able to be here but is interested in the program. So my name is Aruna Chandran. I'm a faculty member in the Department of Epidemiology over at the Bloomberg School of Public Health, and I co-direct the BAMHS program in epidemiology. And I'll just ask Fran and Justin if you could introduce yourselves, and then we'll get started.
Sure. My name is Fran Berman. I'm the Senior Academic Program Manager in the Department of Epidemiology, and I'm thrilled to meet you all today. Justin?
Hi, my name is Justin Schweitzer. I'm the Academic Program Manager for the Master's School of Epidemiology. I'm excited to speak with everyone too.
So again, welcome everyone, and let me get started. So what we're going to do is I'm going to just give you an outline, kind of information and logistics about the program, but as Fran said, we will leave plenty of time for questions during this session. So just to think about the BAMHS and the BAMSPH programs overall, the Bachelor's and Master's of Health Science, or the Bachelor's and Master's of Science in Public Health, are coordinated academic programs. It's a collaboration between the Krieger School of Arts and Sciences and the School of Public Health. So we have these programs in environmental health and engineering, epidemiology, health policy and management, international health, and mental health. And so just so you know, we're here to talk specifically about the epidemiology program, but I'm sure the other groups will be having information sessions and other information available for you as well. Let's see if I can forward. So just briefly, the difference between the MHS and the MSPH, it's really not a whole lot for you to worry about. The MHS is an academic degree that we really see as kind of really mastering the skills, the core skills that you need to work as an epidemiologist, whether that's in a research environment, in a professional practice environment, or in any other capacity of your choosing. The MSPH is more focused as a professional degree, really thinking about applied public health work, and that is offered through the departments in environmental health and engineering and health policy and management. But what is the BAMHS not? It is not a separate special degree program. It is a transition pathway where you complete the full BA in public health studies and other majors as you so choose at the undergraduate campus, and then a full and complete master's degree in public health in the department of your choosing, in our case, epidemiology. So you are actually completing both degrees in full. So if anything, it's actually more of a challenge for you. It's not meant in any way to skimp in either of the degree programs. So how does this work? As a current undergraduate, you would apply for admission to the department of your choosing, so hopefully in our case in epidemiology, during the summer between your junior and senior year. And you're basically expressing your desire to join us in the School of Public Health after you receive your bachelor's degree. And in return for sort of this early commitment and this early connection, you will not have to pay an application fee, and you have a slightly sort of simpler application process. And why should you do this? Because you get to work with us sooner. So you get to have direct coordination, guidance, connections with the School of Public Health and you also get to begin your public health master's work during your senior year as an undergraduate. So the way that will work is that JHSPH credits that are taken during your senior year, up to a total of 16, can be directly applied towards your MHS credit requirement. And any courses that you take that are beyond the 16 credits, of course, will still be used to fulfill any course requirements. We acknowledge the knowledge that you have gained by doing this, even if you can't transfer those credit numbers over to your MHS degree. So here we are, all three of us are on this call. We will be the people that will be primarily helping shepherd you through the process. Fran and Justin are your primary contacts for logistical questions in terms of how the program works. I'm here to help with that, as well as to help advise on content, kind of helping you steer through your degree in epidemiology. But of course, you will also interact with all of the other myriad of faculty that are involved in the Department of Epidemiology, as well as the School of Public Health overall. So what are the timelines? For the MHS in epidemiology, it's a 1 to 2 years depending on how you approach the program, which I will get to in just a minute. But we hope to receive your applications by June 1st. It really helps us to know of your interest as early as possible, but the absolute drop dead deadline is July 1st for you to apply to the BAMHS. And again, this is the summer between your junior and senior years. For those of you who are earlier in the process, we're happy to have you here. We're happy to start talking to you early on, but you can't formally join us in the program until after you've completed your junior year and then you've applied. So how will you approach the MHS portion? You have two choices. You can take the expedited schedule or what we call the regular schedule. So the expedited schedule, what you will do, and I will go into much greater detail on how these schedules work, is essentially you're doing a 15-month program. So the first part of that program is during your senior, it's also combined with your senior year at Homewood. And then the second part of the program, you do your first full year in epidemiology with all of your cohorts that join. And then you take that summer after your first year to finish up, and most people complete all degree requirements that August. So it's 15 months in the School of Public Health, and then you will have started, of course, during your senior year at Homewood. If you do the regular schedule, you still start with us during your senior year at Homewood, but then you do 2 full years with us, or 21 months, in the MHS program. So you will join the cohort of people that join us as MHS students. You will do the first full year, you will do that summer, you will do a second full academic year, and graduate usually in May of that second year. So we do have some tuition support. In the first year, which is the first year of your MHS program, the first full year of your MHS program here at the School of Public Health, you are eligible for a 25% tuition scholarship. And for those of you who do the regular schedule and therefore spend a second academic year with us, that year you will get a 50% tuition scholarship. So why us? Why specifically epidemiology? The mission of our department is to really improve public health by training epidemiologists and really advancing knowledge in which you think about the causes of diseases and morbidity, as well as how we might prevent those diseases, and overall promote the well-being and health of individuals in our target population. We are the oldest autonomous academic department of epidemiology in the world. And in fact, we have done everything we can to sort of maintain this level of leadership in fulfilling this mission over a number of years. And we continue to be a very large, very diverse, and very kind of multifaceted department. This is really an observational science. It's the study of how diseases are distributed and how they spread across populations. We think about the causes or etiology of diseases and thinking about opportunities for controlling and ultimately preventing those disease manifestations. So our goal is to identify these causal agents and also important risk factors that contribute to or augment those diseases that we're interested in controlling. And then, of course, ultimately to develop effective control and prevention strategies. And the way we might do this, there are people that are really focused on identifying and confirming risk factors. It's a really important science. There are people who specialize more in really thinking about evaluating interventions. So they're out in the field as interventions are rolled out and trying to understand how they're working. And then we have everybody in between those two, right? Somebody has to think about developing those interventions. Somebody has to think about designing studies for how interventions can be developed and rolled out. And also people have to think about how do we connect risk factors with particular disease outcomes to really show that that's an important and accurate association. And then, of course, we have people that are really interested in the dissemination of our knowledge and building a scientific foundation for public policy, for legislation, and for advocacy. And that's also an important role of epidemiologists. We'd all love to think that we're experts in every step of this process and everything in between. But the truth is most of us are involved in multiple steps of this process, but really try to develop expertise in particular areas. It is therefore a largely observational science. Certainly there are people involved in clinical trials that are doing more directly experimental work, but there's a large part of epidemiology that doesn't do that directly. Our department here is very large, as I mentioned. One of the ways we try and sort of make sense of how all of us fit together as cogs in this important wheel is the development of research tracks. So each person is primarily assigned to a track, and those tracks include cancer epidemiology, cardiovascular and clinical epi, clinical trials and evidence synthesis, the epidemiology of aging, environmental epi, general epi and methodology, genetic epidemiology, and infectious disease epidemiology. Now, most of us that are involved in these certainly do sort of go across multiple tracks, because you might be involved, for example, in important infectious diseases that affect individuals that as they're aging, and interested in developing methodologies for how to improve that area of scholarly work, but you'll have a primary area of interest. So as you apply to the Department of Epidemiology, you will also apply to a track. So you are sort of stating that that's the area of topical interest that you would really like to develop, and that's where you would like to develop your close mentoring bonds and ultimately, hopefully, pursue your own research work in that area as well. Some of the projects that we do for HIV/AIDS, we have large cohort studies looking at risk groups, as well as evaluation of treatments, and ultimately, as individuals with HIV now are living longer, looking at aging as it relates specifically to individuals who are living with HIV and have been taking these medications for many years. We have individuals in cardiovascular diseases that are interested in doing both cohort or case control studies in cardiovascular disease and kidney disease. In cancer, for example, there are community-based cohorts as well as hospital-based studies thinking about different types of cancers, and then how these affect the other parts of their lives, and how they're able to manage sort of this management of a serious disease issue, as well as continue their other aspects of well-being. In genetic epidemiology, thinking of autism, birth defects, asthma, kidney disease, and really thinking about how we do that with these large consortia of data. These huge data sets, and how do we think about genetic ancestry and what that means, as well as your genes are modified by the environment in which you live. And then certainly clinical trials, and then the important work of putting that information together in systematic reviews so that we can really advance medical science, as well as the screening and interventions that we develop. And these are all projects and many more that you all will have the opportunity to get involved with should you join us here in the Department of Epi. So a little bit more detail about how to apply. First, why would you do that? You get to take the next step in your academic and research training career a little bit earlier, because you already know prior to starting your senior year what you're going to be doing next. And so not only do you have the opportunity to take up to 16 credits during your senior year, really get a head start on your MHS, but also have that opportunity to start connecting with people, building those mentoring relationships, and even starting on some of your own work during that time. But you also have the opportunity to just start connecting with us, start attending seminars, learning a little bit more about epidemiology and all of the different areas that you could get involved. So what do? You apply through Sophus Express in May or June, sort of towards the end of your junior year or following your junior year. We need to see from you your transcript, 3 letters of reference, your resume, and a statement. Why public health? Why epidemiology? Convince us that you've thought about what epidemiology is, what it means, and where you would like to fit into that broader schema. For your reference letters, one needs to be from your public health studies advisor, and they're well aware of that and have been working with us for many years in making sure this happens. Once admitted, you work with me, the program director, on sort of planning how you're going to structure the program to best meet your needs and your goals. We have people that spend 95% of their senior year really connected to the School of Public Health, doing School of Public Health coursework, starting on projects. And we have people that spend 5% of their time during their senior year with us, in that they're not quite ready yet to make the leap, but they want to just, start these conversations, make sure I know who they are, and maybe attend a seminar or two, and everything in between. And we'll talk a little bit about, based on your goals, when you hope to graduate, what you hope to do next, what makes sense, and then what I recommend for how you should spend your senior year. In terms of putting together your application, we do supply some guidelines for what we want to see in your statement of objectives. Your public health studies advisors are very used to this process as well. They absolutely can be your first go-to as far as what you want to put in that statement. I would also highly recommend have some other people look at it. You know, good friends who are really good at writing, who may not be interested in science or public health, can be really helpful. So kind of feel free to pedal that around a bit. We, just in the sense of fairness, can't take your actual statement and give you direct comments, but we're very happy to kind of talk to you more in general about what you, what you might want to do to put together the best application possible. So, as I mentioned, there are two ways that you might go through the BAMHS. And because of the way that the coursework works, the statistics coursework and ultimately the epidemiology coursework, every course builds on itself and it's really designed as a 4-term sequence. Again, we work in terms, which are essentially half semesters. So everything starts in the fall, then you have the second term, then you go into the winter. So because of that, you cannot start the program in January, just so you're aware. It begins in September. So given that, you might do this expedited path or you might do the regular path. So let me go into both of those in detail. So let's say you're doing the expedited path. You've decided that you would like to complete the MHS degree in that 15-month period that I described. So you're sophomore, those of you who are sophomores, maybe you're here now, you're attending this info session, you're going to follow up thinking about your areas of interest. And you might even begin just making sure you complete the undergraduate side of coursework that you need to take to complete your public health studies major, as well as any other programs or certificates that you're pursuing there. For those of you who are juniors, don't worry, you're not behind the 8 ball at all. We just hope that you've done the fundamental, you're planning to take or you've taken the fundamentals of EPI course and sort of started thinking about your interest in public health and your commitment specifically to epidemiology. You would start putting together your application and again, have everything in hopefully by June 1st, but certainly by July 1st. And then you will, once accepted to the program, let us know by August 15th whether or not you plan to pursue this degree. At that point, once you've committed, I would be happy to meet with you. We will plan on meeting with you. And Fran and Justin will definitely be reaching out to you as well. And we'll really think about what your goals are, what you hope to get out of this program, what you hope to do next, and think about how to structure the program. Here's an example of how you might do that. In your senior year, you would jump right in and take our biostatistics series. That's the courses listed 621 to 624. So starting in September, it's a 4-term sequence. So you would be doing that through the School of Public Health. You would also sign up for what's called Current Topics, which is a really interesting, important series of seminars in which we introduce you to the broad range of work that's going on in epidemiology today, as well as you have the opportunity to hear from doctoral students and advanced master's students on the actual research work that they're doing. So their proposals are actually presented during the Current Topics series. There are also panel discussions on important topics and where epidemiology fits in. So a really nice way to get you introduced to the breadth and depth of epi. You might also take some electives for the academic track that you selected because you're just dying to get involved in cancer epi already, and you're absolutely welcome to take some of their elective courses or required courses for that track. Or you might instead say, I really want to focus on the honors curriculum at Homewood. You can do both JHSPH coursework and honors program work, but we need to be pretty coordinated with the honors program director there because that is a lot to undertake. So generally people don't do that, but certainly we can talk to you if that's particular interest. But as you're taking your biostatistics, you will be meeting with me regularly. I actually meet with the BAMHS cohort, specifically the seniors that are in the BAMHS program, and Fran and Justin join these meetings at least once a semester, and sometimes a little bit more often. With the pandemic, we've been doing these virtually, but obviously we hope eventually that for some of those meetings, we can come to you all, to the Homewood campus, so that we have a chance to meet in person. But either way, we will start talking about identifying possible mentors, thesis advisors, what you might want to do in the summer between your BA and MHS, and how you might best leverage these opportunities in that time. And in the meantime, you go ahead and graduate from the Krieger School for your undergraduate degree. That summer, you may start connecting with your research mentor. Again, if you're on the expedited plan, we really recommend that you do this. You will start getting involved. You might get involved in summer work that is sort of related to your thesis project. It may allow you to get familiar with the data with your research group and to actually start working on some of the work that you're doing. And you can actually register for credit. So interestingly, you will not be a student that summer. So you will not get those credits in the summer term, but instead you will actually get them in the first term, but it's for work that you did over the summer. So we will help you in negotiating that so you can actually reflect that commitment that you've done. Then you join us at the School of Public Health. So you will actually attend JHS-PH orientation in late August. That will be with the incoming MHS cohort, those individuals that did not do the BAMHS program, whether they did their undergraduate at Hopkins or not. So you will join us for orientation. And for those of you who did do the statistics series, you will have the slight advantage of already having taken the biostatistics coursework. And so you will feel comfortable with all the things we're talking about, not only specifically with statistics, but also the pace of the program, the way the courses work, the way the faculty are, et cetera. You will take your epidemiologic method series that year. Just to be clear, you cannot take that during your senior year at Homewood. You have to take that during your MHS year. And simultaneously, you will be continuing to work on your thesis. You will take any other courses that are required for your track, any other electives that you're interested in, and be involved in whatever other projects or other things that you want to do. Upon completion of the required courses for your track, as well as the epidemiologic method series, you are eligible to sit for comprehensive exams, which are given in May. Everybody has to take those comprehensive exams. Once you finish that, you will actually register for 2 credits for thesis research with your advisor, and you will complete your work on your thesis. So most people, June and July, you're kind of wrapping things up. At the end of July, we actually have a special poster session for the BAMHS crew, and you will do a presentation of your research project. That's usually a really cool opportunity to show off all of the work that you've done. And ultimately, you will complete all of your degree requirements and graduate from the program at the latest end of August. Now, for those of you who want to say, for example, go on to medical school, you might say my medical school starts August 1st. Great, subtract 3 weeks from everything I said. So you have to have everything done just as had earlier. You'll still present your poster at the poster session at the end of July. You will make sure with Fran and Justin that you've checked all the boxes and you can go off and start in medical school on August 1st. You will still get your degree at the end of August. We can't change that date, but you'll be done with everything. And so we can tell us, for example, give you a letter that says you've completed all degree requirements for the MHS in epidemiology. So that sounds like a lot, and to be perfectly honest, it is, right? That's what it's intended to be. This is an expedited program. You are still completing the full MHS in that time period. So this really is, works well for people who know that this is what they want to do and have a pretty good plan for what they want to do next. That is, I don't want to drag out school forever. I'd really like to go on to vet school or med school or, go on to work so that I can move towards my PhD, those kind of things. So if you have a pretty clear sense of your plan, the expedited pathway is an excellent opportunity to kind of move things along. But for those of you who think that's crazy, you're right, then you can do the regular program. So what that means is you still join us. You follow the compressed timeline. Senior year, you can still take statistics and you can still start getting connected with your thesis advisor and even spend that summer after your graduation from the BA starting to work on some of your thesis work. You don't have to, but you can. Then you will attend JHS-PH orientation, and at that point, you're really sort of working as if you are a regular MHS student, although we will still consider you part of our BA-MHS cohort. So you will attend the orientation, you will take course requirements, you will later in the year, you can identify a thesis advisor, you will take and pass your comprehensive exam. Over the summer, between your first and second years of the MHS, you will start working on your thesis. You'll identify a topic, get your IRB issues cleared up, you will start thinking about what it is you want to do. In your second year, you will take any remaining required coursework, as well as any other courses you want to take. You will really build a full second year, as our MHS cohort does. Some people make that a very coursework heavy year. Some people make that an opportunity to work on multiple projects of different kinds, whatever it is that you want to do, and we'll help you structure that. You will then complete your thesis. You will prepare and present your poster in April of year 2, and this will be done with all of the MHS, regular MHS cohort, and then you will graduate in May of that second year. So again, you have the full time of the MHS and epidemiology, but with the advantage of having sort of kick-started early during your senior year. So a couple of questions that we often get that I'll sort of head off at the pass. Is the MHS any different from the regular MHS degree in epidemiology at JHSPH? No, you will get the exact same degree as everyone else. You will have completed the exact same course requirements and comprehensive exam requirements and thesis requirements as everyone else. You don't get a pass on your thesis just because you're a BA MHS student. We still expect the same high quality thesis that we do from everybody else. Can I apply to more than one department? So, you know, I like Aruna, epidemiology sounds good, but I'm also really thinking about environmental health and engineering. No problem. Okay, we understand and you can do that. I'm not absolutely certain I want to do the MHS. Am I locked in? No, but you are, if you apply through the BAMHS and that's the only way you apply, you will keep your degree as the MHS degree. We do have a separate degree called the SCM, the Master of Science in Epidemiology, and that requires a year of work experience before you join us. So because you all are coming directly from your undergraduate degree, you can't hop over to the SCM degree. But you are absolutely not locked in. We give you until August 15th of that year to commit. You can change your mind. You can, you know, go do something else and come back and apply as a regular MHS or SCM student. It's no problem. We don't sort of black mark against you for having thought about it early and decided against it. Is it possible to apply during the regular cycle as a senior? You know, say, forget you all and I want to do this. You can, but you will have to apply as if you're a regular MHS student. So you will apply, you'll pay the application fee and you'll apply through the regular SOSIS system. You also sort of lose the benefit of that early engagement during your senior year. So at that point, it's sort of less important whether you call yourself a BA MHS student, but really that you're interested in the MHS and epidemiology. So what's the deadline if you are offered admission? It's August 15th. So you need to tell us by August 15th after your junior year or just prior to your senior year, whether or not you want to join us. And again, I just popped up here the application materials that you need to compile in order to come to us. So here we are again. Didn't want to lose an opportunity to show you our pictures again. So while I'm doing that, that really ends our major sort of formal presentation that we wanted to have for you. So first, let me just pause. And Fran and Justin, did I miss anything as I went through this?
Thanks, Aruna. That was wonderful. You ran through everything that we like the students to know, but we certainly want to open this up.
Yeah.
If you have any questions, I'll remove Aruna's spotlight so that you can see us. And then it looks like we can start answering the questions in the chat. Aruna, did you want to stop sharing or are there additional?
Oh, I'm so sorry. Yeah, let me stop sharing. And then Fran, I think the first question, when did the decisions come out? So can you answer that one?
Sure, we're certainly going to try to get the decisions out to you by the middle of July so that you do have time to make your final decision as well regarding our offer.
Yeah.
Do y'all want to turn on your faces so that we can see you? There's a lot of folks online.
Hi.
Hi, Helen. How are you?
Hi. I'm good. How are you? I just had a quick question. For the expedited program,
Yeah.
Is that something that's only through the BA MHS, or is that all MHS students can do the expedited option?
Well, some of our MHS students who come in with a really strong research project question can crush it, but it really means that in addition to just starting off with all of the classes at one time, you're also starting to try and figure out a research project. So it's not ideal, but we do have some students who do this every year.
I'll be honest, it generally works better with the BAMHS students because you have that extra year to do some of the coursework in advance. The other thing I will say is that there are people, however, who sort of do the majority of their courses and all of their other check boxes and spend the second year doing a lot of time on other work. So I actually had an advisee who worked through Baltimore Core and did an evaluation of a big city level violence prevention program during her second year. So you can really take that second year and do exciting applied work, even though technically sort of you're still a student with us and you don't get your degree until the end of that year. So people really structure their second years very, very differently. There's a question, sorry, in the chat. Are there admission statistics for BAMHS programs in general or specific to the department? Fran, any statistics?
No, but I will say that you all are an amazing group of students. Our Hopkins undergrads are absolutely qualified. So we're really looking for students to come in with a 3.0 grade point average from undergrad. Higher is always nicer, but not required. I would say that unless you've had a difficult time with fundamentals of epidemiology or some of the other public health studies courses, you'll be fine. We try to admit everybody that we can.
We really do. Yeah, it's a pretty high admission rate for this program because mostly those of you who are interested, you come to things like this and you're really thoughtful. So the one thing I would just add is I think in the statement, we're just looking for some idea that you know what public health is, you know what epidemiology is, right? It's you know, you're coming to a school of public health that has numerous programs and numerous areas of options for specialization. We just want to make sure that you've really thought through that you're selecting epidemiology. And by selecting epidemiology, you are by definition not doing health policy and management or something else. So we want to just see some evidence. That doesn't mean you have to come in and say, hey, Aruna, I want to work on this particular gene for my entire career. I'm just looking for, I know what epidemiology means. I know what public health is all about. And this is the area that I think I would really like to see myself, at least for the master's component of my future career, really devote myself. Do internships in public health during undergrad years count as work experience for the SCM? No.
Yeah.
They do not.
Sorry, Kelly. We're glad that you've gotten some internship experience, but the SCM is really looking for just a little bit more of the full-time work experience, holding down a job, really having a chance to work in the field. Yeah. Others?
Yeah, and feel free to unmute yourself. Yeah, go ahead, Helen.
Yeah, I was going to ask about the different tracks that are within the epidemiology department.
Yeah.
When you apply, I know that you described that you kind of talk about which one you're interested in, but is there kind of freedom to move from like cancer to genetics, or are you like stuck in one?
Good question. So when you apply, you do apply to a track, right? We are sort of assigned to a track. Can you switch tracks? Absolutely, but there's a couple things you want to keep in mind. In order to sit for the comprehensive exam, you have to fulfill the requirements not only of the epidemiology program overall, which is basically your epidemiology and statistics courses, but also the requirements for that track. So as you can imagine, the farther you go through the program, the harder it's going to be to jump over to another track. So what I generally tell people is if early on in the program, you sort of applied to cancer epi because you've done cancer work before. And once you started in the first semester of statistics, you attended a current topics and wow, you've now been turned on by, epidemiology of aging, or whatever it is. That's a really good time to have that conversation with me and really think about, is this a good time to switch tracks, right? If a year and a half into the program, you're like, oh gosh, my thesis is a lot more on aging than it is on whatever. Not a good plan to switch track, right? No one's stopping you from doing your thesis in a topic area that's outside of your track. In fact, most of us end up doing things that kind of blend principles of more than one track. So you can absolutely end up doing your thesis in an area that sort of traverses tracks or even sort of fits in more in another track, and then just make sure you sort of, we'll work with you to sort of build a very nice narrative as to why, this particular track and this particular topic area of interest is such a beautiful niche that you've created for yourself, and therefore they should accept you to vet school or wherever it is you're going next.
So I saw, Joe, you have a question about deadlines and other programs that are available within the School of Public Health. So I have an entire list that I'm going to pop into that chat of all of the programs that are still accepting applications. We are not, but that's okay. The School of Public Health is huge, and you can certainly participate in joint research with your host department. And, you know, certainly some of the other programs that are open are, you know, very closely tied to the work that we do, especially in environmental health and international health.
And I think if you really are, you know, sort of, as you said, a bit late to the party and you're really, you know, you have this budding interest in epidemiology, you can also spend a year after you finish your undergraduate degree working in an area that's related, getting an opportunity to do some on the ground epi-related field work, for example. Many people in epidemiology feel like they don't get a lot of chances to do primary data collection while they're here. Spend this year doing that, right? Go out and get that job that really allows you to directly and, you know, do some epi, and then come back to our MHS program or SEM program. I think that makes you a really strong candidate for that kind of future work in epi, and so that's also an option.
So there's two questions. Kelly, I'll get to yours in a second, but sorry about the fire drill. That's annoying.
Oh.
And there was in their dorm. So yeah, we're going to have this recording posted somewhere on our website, but we're also going to give it to the Public Health Studies office so they can.
And we can share the slides too, right, Fran?
Yeah.
So we can do both. Yep.
Yeah.
As far as the question about references, so what I generally say is think about someone who knows you well and who can speak to some aspect of what kind of student you are, what kind of worker you are, your commitment to sort of a project. It doesn't even have to be a project in public health per se. So essentially, we don't want to see a letter from your grandmother, right? We want to see a letter from a former supervisor is a great example, you know, that worked with you in an internship that could speak to how do you approach a project, how do you face challenges, how do you sort of take on that independent role, but yet come to them when needed, things like that. A professor that you took a class with that was a small class where you really, or something where you really required close engagement with that individual. Maybe it was an upper level class that had a project component, something like that. So they can really speak to how you were as a student and how you approached that work, you know, and things like that. Certainly a PI of a lab that you're associated with is great. If you did summer internship work and again, developed a good relationship with your supervisor or your PI, that's a great example. I think there aren't a lot of restrictions other than, you know, sort of someone who's more of a friendly acquaintance, sort of talking about what a nice person you are is not as helpful to us. Can you stack on scholarships funding from centers with the masters? So if you're continuing in aging and they have funding for graduate students, yes, we love that. Absolutely, right? So any opportunities to make money is positively viewed by our office. So what that means is that you will just need to, the things I would warn you, just make sure that you're very clear with what commitment you can offer them. Okay, so the one thing I would tell you is certainly even during your senior year, the statistics courses, the pace of our courses is really fast. We work on terms, which means we don't spend the first day going over the syllabus and thinking about, existentially, what does statistics mean to you? We spend the first day going over material because in 4 weeks you're taking midterms and in 8 weeks you're taking finals. And then you turn around and start 2 days later because somehow we don't build in a fall break. And then you do it all over again. In 4 weeks, you're taking midterms, and in 8 weeks, you're taking finals. So you just want to be really careful in sort of what commitment you're making. The last thing you want to do is tell somebody that you're available to work 20 hours a week on their really important project because you're excited about the potential paycheck, and then figure out that there's no way you can give that much time. So just really think about that commitment, and that same thing transfers over to your MHS year, right? On one hand, you all are at a huge advantage. You will have finished your statistics series before you join us. So you will have this opportunity, this time that you can give to projects as well as to your thesis. But on the other hand, epidemiology is not a cakewalk, and neither are there other required courses for your degree. So I think absolutely, please continue those relationships, Sandy. That's wonderful. And in fact, that can be really great help with your thesis or your future work as you're thinking about it. But just be really transparent. And the nice thing is that in pretty much all of our centers, our faculty are faculty in the Department of Epidemiology. We know exactly what courses you need to take and what requirements you need to fulfill for the department. So we're happy to work with you to figure out how can we best, sort of think about a course load and a workload that you can balance. But ultimately, you know yourself best, so you make sure to think about that. Questions? The statistics requirement. Okay, so good question. So short answer is yes, okay. The vast majority of students take the 620 series. It is a appropriately difficult, very interesting, and truly prepares you to be an active epidemiologist, right? Not just someone who reads, studies, and interprets the results, but truly can conduct epidemiologic analysis yourself. If you are extremely quantitatively oriented, the 650 series is almost more of people who are sort of half biostatisticians, half epidemiologists. So it really thinks about deriving the formulas that you're thinking about doing, creating those packages in software programs for you to do these things. It's really driven at that. You need to know linear algebra to take the 650 series. If the words inverting a matrix mean nothing to you, then you will not be able to do the 650 series. However, if you know exactly what I'm talking about when I say inverting a matrix, we've had a couple of students in your positions as BAMHS students taking the 650 series, and ironically, they seem to do better than some of our master's students because the material is really fresh for you. So I am absolutely an advocate for those of you who are very quantitatively inclined. The one thing I say is, most of us got to this point where we're contemplating a master's at Johns Hopkins because we were very successful students, right? And the lesson that you learned in high school and in undergrad, take the hardest course you can, right? Because that really shows that you're working hard and that you really care. We don't do that anymore. What I recommend is think about what kind of epidemiologist you want to be. So if you are really interested in being the kind of epidemiologist that's out there and really creatively evaluating on-the-ground interventions, and you really want to work in grassroots epidemiology, you don't necessarily need to be deriving your own statistical formulas, right? That doesn't really mesh very well. Whereas if you really want to sit there as an advanced genetic epidemiologist and code in Python and work on, developing new methods for how this regression model should be run, then absolutely you need that 650 series. And that's something that I'm happy to help talk you through as we plan your program. That's what I mean by what are your goals and how might you structure the program to best fit those goals. Are other MHS programs holding info sessions like this, Fran? Do you know?
I don't know. They should be. I can certainly ask them, but if you have questions and want to talk with the other areas or departments of the school, certainly reach out to the academic program managers, academic coordinators. If you're unsure who they are, Justin and I can forward their names to you.
And also your public health studies advisor also can help you to know who the contact people are for those areas. But hopefully they are as cool as us and also holding information sessions. But we don't know.
Justin, did you have anything else that you wanted to add? I know that we're about 10 minutes on the hour, and you guys need a break before you head to your next.
Yeah, please, absolutely. If anyone needs to drop off and go to class, we're, please do so. And also, we did in the slides, and which we will supply with the recording, we have all of our contact information. So, please feel free to reach out if there are questions specific to your situation that we didn't answer.